Over the last 25 years, I've had the privilege of interviewing and highlighting some truly interesting people. Everyone who is anyone, both the famous and the infamous, from presidents and their first ladies to kings and queens, movie stars and pop stars, captains of industry, heads of state, sports personalities, innovative entrepreneurs, and some pretty fascinating everyday people. Today, I am proud to introduce you to Susan Roper, Dr. Susan Roper, a board certified dermatologist who says staying healthy and doing the best she can for her patients has made her professional success possible. Dr. Roper, it's a pleasure to say hello to you. And I guess the first question out the box is, how did you come to be a dermatologist? What actually pushed you in that direction?
I was a fourth year medical student and attended a conference given by the brand new chairman of the Department of Dermatology at Emory University School of Medicine, and became fascinated with the avenues of research that was going on in dermatology at that time. And it was 1980, uh, actually 1979.
Oh, I actually, as I think about that back in the day, there so many things have changed in the area of dermatology. Even just our consciousness about skin being an organ of the body. I mean, obviously, you learned that from the beginning, but I'm not sure that the general public had really thought about it that way. But in fact, it is the largest organ of the body. So tell me, what services does your practice provide that others might not?
Well, we provide a broad range of services that include surgery, Mohs surgery, medical dermatology, and cosmetic dermatology. And in 1979, when I first became interested in dermatology, cosmetic dermatology did not exist, and except for maybe some filler, um, and the medical dermatology was uh, going into research mode. We did not know what caused psoriasis. We did not know what caused a lot of the dermatologic diseases that we were treating. So we were heavily into research, and our program was only taking students who were interested in research. So I applied for a research grant with the Dermatology Foundation. I won a research grant, and I was accepted into the dermatology program at Emory University.
So that thus began your career. Um, I love to get some examples of things that have changed and the kinds of innovations that you've been able to put in place. So, are there any notable success stories that you can share, obviously without violating doctor-patient confidentiality?
Well, I have many stories, um,
Just give
but
me a couple.
none that will probably interest you. But the stories over and over and over again is that people come in to take care of things that have popped up on their skin, and we may find a melanoma, we may find a skin cancer, and even with the cosmetic dermatology I do, I will spot many times a melanoma or another type of skin cancer on their skin while they're in asking me about their wrinkles or whether or not they need Botox. So I think the story begins and ends with the skin cancer epidemic, which, as I entered the field of dermatology when I finished my residency in the year 1985, the epidemic was just getting started. And every year since then, the number of skin cancers has increased. So we have not stopped our epidemic, but we have been able to insert ourselves into the process of finding the cancers and removing them before it affects the patient's health. Currently, we have 15,000 people a year die from squamous cell carcinoma, but we have been able to decrease the death rate in the melanoma patients with all the new immunotherapies and chemotherapies that have been researched over the last 20 to 30 years. So we're proud of that fact that the the death rate has dropped from melanoma quite a bit.
Fantastic. And I think what has to have helped is the awareness campaigns that have been going on over the last couple of decades to make this a front burner issue when it comes to one of the kinds of cancers that people should be mindful of. You know, as I think about all of our different success in our different professions, Dr. Roper, tell me what role you think your family has played in your success.
Well, my family has been very supportive. They didn't get to see a lot of me. I would get home late. I worked Monday through Friday. But when my kids were there, I was there for them. My husband was very supportive. He had his own life. He didn't depend on me for entertainment. So I was real blessed that I have, and he's still with me, a great husband and
Mm-hmm.
great kids. They're all grown now. One's a dentist, one's an accountant, one's a histotechnologist, and they all, are doing well on their own. So that's all we can hope for, is that our kids can survive without us.
You better believe it. I have a 16-year-old son who's turning 17 in a couple of months, and my fervent hope is that he can stand on his own 2 feet and become that proud young man that we've raised him to be. I know that the work you do is very, very important to you, but I have to ask, what role, if any, does community service play in your practice, professionally or personally?
I think community service is very important. Um, I've been doing skin cancer screens ever since I became a dermatologist. Um, May is Melanoma Awareness Month, so usually the first Monday in May, we're doing skin cancer screens at the hospitals. And I volunteer for the VA. I'm a 22-year volunteer, and I donate to all my favorite nonprofit organizations, including the Homeless Emergency Project, the Food Promotion Projects, and Salvation Army, and there's just a whole host of nonprofits that I like to support. But I do spend most of my time in the office, taking care of my patients, giving them the best care, um, helping people get through whatever they're getting through with their skin. So that has taken a good deal of my time.
It makes complete sense. As a matter of fact, speaking of your practice, I see that you were named Surgeon of the Year in 2006. What were the circumstances that led to you receiving this award and this honor?
Well, that came from the Florida Society of Dermatologic Surgeons. I practice in sunny Florida, and I've been a member of the Florida Society of Dermatologic Surgeons ever since I came to Florida in 1985. And every year I would present a lecture. I would lecture on difficult surgery cases. I was the first member to actually present laser cases to the society. And I was fortunate enough and proud to be elected president of the society. And almost in the same year, I got awarded the Surgeon of the Year award, which was a huge honor for me. So that was directly coming from my peers in dermatology. That was not coming from my patients, but from my colleagues.
Yes.
So I was very proud of that.
Yes, indeed, as well you should. Thinking of all the changes that have occurred when it comes to your area of medicine, what improvements have you introduced to your practice because of some of those changes?
Every year I always look at the practice and try to decide, what new things we want to take on, new procedures. We took on a new procedure about 10, 15 years ago where we could get the sun damage off the skin called photodynamic therapy using a product called Lebulin and a blue light that doesn't have ultraviolet in it. So, looking at the new procedures and looking at the new medications and drugs that come out every year, things come and go, just like there used to be Tab. It was a diet drink years and years ago, and now, no longer exists. Same thing happens in medicine. Things come out, they don't make it, they fall by the wayside. So, every year we get new things to look at, new drugs, new procedures, and trying to decide which ones to bring into the practice and which ones, may need a little more time before, I give it special consideration.
Makes complete sense. And Dr. Roper, lastly, what's the one thing you'd like the viewer of this video feature to walk away with today?
That dermatology is a field that is growing and changing every day. I would like my patients to be safe and cancer-free. I would like them all to wear their sunscreen. If they're, especially if they're living in the South, even if they have no intention of going in the sun, usually just the in and out and the driving in the car is enough. But just to let my viewers know that I represent many, many dermatologists that are working very hard and are the best trained physicians to check your skin for skin cancer. It's been shown time and time again that the dermatologist's eye beats artificial intelligence every time when it comes to detecting skin cancer and melanoma. So if you need to have your skin checked, you can't do any better than finding your board certified dermatologist to go check your skin for you.
Nothing beats that one-on-one patient-doctor relationship, and now I see why your motto is to do the best you can for your patients. Dr. Roper, thank you so very much for your conversation today.
Thank you, Star. So it was so nice to talk to you today.
It's a pleasure.